All right, our top focus on news today is the highly contagious UK strain of the novel coronavirus. Viewers, it's been detected right now in India. We've got 6 citizens who have tested positive for this mutation. They had recently traveled to the United Kingdom and have tested positive for the strain. The government, however, says that while the mutant strain is definitely more transmissible to the tune of 70% more transmissible, it is not deadlier than other strains. Here's more.
The mutant novel coronavirus that forced a fresh lockdown in the United Kingdom has made its way into India. 1,000 passengers who came from UK to India between 25th November and 22nd December, 114 passengers tested positive for COVID. Genome sequencing has shown 6 of them have the new strain. 3 samples tested positive at NIMHANS, Bengaluru, 2 at the Center for Cellular and Molecular Biology, Hyderabad, and 1 at the National Institute of Virology, Pune. The mutant B117 is 70% more transmissible.
Accumulating mutations in any living organism, including viruses, it's a natural process, and therefore we should not worry about the natural process of virus accumulating mutations. It is not killing more number of people. So it's only spreading to more number of people, but it's not any more lethal than the previous strain. Therefore, we should not be worried too much about it.
The government says while the new strain is more transmissible, there's no evidence it is deadlier than the earlier one.
एक चेंज ऐसा है जो जब वायरस हमारे सेल्स के अंदर आती है, एक रिसेप्टर से अटैच करके अंदर जाती है. इस अटैचमेंट की एफिनिटी वो जो लगान जो है वो ज़्यादा कर देती है, इसीलिए ट्रांसमिशन ज़्यादा हो सकती है. So there is no evidence that the current vaccines will fail to protect against COVID-19 on the variants reported from UK or South Africa.
The government is taking no chances. Patients who have tested positive are being kept in single-room isolation at healthcare facilities in their states. Their close contacts are quarantined.
11 months into the pandemic, India is now looking at an entry of the new mutant coronavirus strain that has come from the United Kingdom. 6 who have tested positive have been kept in various isolation facilities. The government doesn't want to take a chance because this strain has particularly been found to be 70% more infectious than the previous strain that came from China and other places. With Premchand Mishra, this is Milan Sharma for India Today.
All right, so the big questions that we're going to be asking tonight is how can India prevent this mutant spread? We already have 6 confirmed cases. There are more being tested as we speak, viewers. And can the vaccines eradicate COVID, especially this particular strain, and do rapid mutations mean COVID is here to stay? Are we actually moving from a pandemic to an endemic, which is here to stay? Those are the questions we're going to put forth to our guest this evening. I have Dr. K. Srinath Reddy. He's President, PHFI, Gurugram. Welcome, sir. We also have Dr. Vikram Taulikar, a Goan doctor. He's based in the United Kingdom and importantly is now part of the Oxford vaccine human trials. And he's an associated specialist with the University College London Hospital NHS Trust. I also have Dr. Rajesh Parekh. He's come on our show many times. He's the Director, Medical Research and Neuropsychiatry's Jaslok Hospital and Research Centre, Mumbai. I want to cut across first to Dr. Talukar. And Dr. Talukar, the question is, you're part of the human trials where the vaccine is concerned, the Oxford vaccine is concerned. The biggest fear right now, sir, emerges from the fact that will the efficacy of the various vaccines, and India standing at the cusp of rolling out its own vaccine drive, would it be less where this particular mutant strain is concerned?
Thanks for having me on the show, Preeti. I think we shouldn't worry, we shouldn't panic. From all the data we have so far, it looks quite reassuring that the vaccines will work against the new mutant strain. Although it affects the part of the virus that binds to cells, which is the spike protein, that's the key for the virus. The vaccine makers usually target quite a broad part of that virus. So they often take into consideration that the virus will mutate when they make the vaccine in the first place. So it looks like the vaccines which are there currently, whether it's the Pfizer, Moderna, or the Oxford, it looks like they should work against this virus. There is more lab testing going on. There are more data being accumulated. But at the moment, it's quite reassuring, and it looks like the vaccines will do their job. So that's good news for the moment.
All right, well, good news for the moment. You know, Dr. Reddy, India is right now at the cusp of their own vaccine rollout. And there are multiple questions right now regarding whether, you know, the efficacy of this vaccine will be lesser where this new strain is concerned. We've had Dr. Talukar who's saying that till now it doesn't seem to suggest, which prompts me to ask you, sir, that we've seen a lot of mutations of this virus. If you remember right in the beginning, the early months of COVID in India, you know, we were talking about an Indore strain, we were talking about a different strain in Ahmedabad, which could have been deadlier. So is there much to worry about? Yes, we know it's 70% more contagious, this particular strain which has emerged from the United Kingdom. But does it keep happening? Mutations keep happening. Have we seen multiple mutations already?
Well, mutations do happen, and it's in the nature of viruses to mutate. The question is, how distorted is the architecture of the virus that it is no longer recognizable by the vaccine or the immunity produced by the vaccine? If this virus has actually brought about some changes in the spike protein, but the spike protein is still very much there as a part of its corona, and the vaccine produces immunity which can still attack the spike protein and prevent the virus from actually entering the cells with great ease, then the vaccine should be quite effective even now. We have no evidence thus far that the vaccine produced immunity is likely to be evaded by the virus because of these changes. But even if that should happen at some point in time, there are other vaccines which are not so specifically directed only at the spike protein. For example, our own country is producing an inactivated virus vaccine, which is likely to have a different target in terms of a broader range of targets for the vaccine. So I believe that firstly, we are right now not in any danger of losing vaccine efficacy for the vaccines that we already have. But should that happen, there are other possibilities that we can utilize.
You know, that's a question I'd like to take to Dr. Parekh, because taking off from, you know, what Dr. Shrikant was saying, Dr. Parekh, the fact is now if there are going to be future mutations, we've seen one in the form of the UK strain, which is 70% more contagious. If this virus is going to continue to mutate further, will those mutations, you know, will the vaccines be as effective on those mutations as well?
Well, we can conjecture on that. Always a pleasure to be with you, Preeti. But in a sense, I feel that I'm not taking off just from what Dr. Reddy has said, but from a conversation that you and I have had several months ago. If you will recollect, you know, we did allude to these mutations in the month of March. When we wrote our book on the coronavirus, we devoted over 2,000 words, approximately 6 pages, to just mutations, because we anticipated, and we clearly you know, put that out in the book then, that we could be entering a scenario which we are facing today. So you and I have had this conversation. If we are to continue it into your specific question, that what will the vaccines accomplish? Let's look at it this way. I agree with my colleagues. There have been over 1,000 mutations in the virus. How is this one different? The B117, how is it different? Well, there are 23 mutations in the virus, but 8 of these mutations are on the dreaded S protein, the spike protein, which is like a key granting access into the human cells. So that's a cause for concern. But on the other hand, there is an ameliorating factor, and that is, as some of the speakers alluded, it's in the nature of the vaccines. See, all vaccines are not equal. They're constructed on different platforms. The mRNA vaccines, the Moderna vaccine and the Pfizer vaccine, they're far more amenable to being tweaked to be able to deal with these mutations. Just to give you an example of how rapidly this can work, on the 11th of January 2020, the Chinese released the genome sequence of the virus. In 2 days, exactly 2 days, Moderna had it ready for a virus. And within 63 days of the 11th of January, they had dosed the first human. So this moves very rapidly. and it should be possible to tweak at least the mRNA platforms rapidly enough in case the vaccine is not already addressing this mutation.
You know, but I'll bring in Dr. Talukar in this because, Doctor, with what Dr. Parekh is saying, now that could generate a fair amount of anxiety. Let's look at it. You know, you've got Pfizer, you've got Moderna, you've got Oxford, you've got Sputnik. Now, if only some of them are going to have a larger efficacy on, say, mutations, then, you know, one would be very anxious. Am I being given, say, a Sputnik V, which might not be as effective, say, as Moderna?
Well, I wouldn't worry about what vaccine you get at this stage, especially because as things stand now, with all the mutations we've seen with the virus, all vaccines still stand effective. So if you're offered either Moderna, whether Pfizer or whether it's Oxford, all of them have efficacy more than 70%. Most of them have efficacy 90 to 95%. Now, all those efficacy figures are excellent, which means that they actually are very effective. They won't let you die from the disease. They won't make the disease severe, even if you catch the infection. So efficacy figures are really good. It doesn't matter which vaccine you get through your health system. You should go for the one that you get as soon as possible. The other thing to say is it's only the Oxford vaccine, which is also having some indication that it actually prevents transmission. So remember, all vaccines prevent severe illness or they prevent you having severe disease or death. But actually, the Oxford vaccine also may be preventing transmission, which means even if you're asymptomatic, you probably won't transmit it to others. Now, we need more data on this, but there's a hint of this in the data we have. So I would say don't worry about which vaccine you get access to. All are pretty safe, very good efficacy. Go for the one because you want to get vaccinated as soon as you're offered your first vaccine.
You know, that's very important, Doctor, the point that you're making, because everybody's saying, no, I will wait for an Oxford or I will wait for a Moderna, not Pfizer. You know, there's so much going on, or Pfizer is the best. But that's point that you've made is quite clear. Go for the one you get as soon as possible, get vaccinated and move on from there. But Dr. Reddy, I'll bring you in because we're talking about these multiple strains and we're talking about future mutations as well. For someone who's already had COVID and has developed antibodies, let's say I've had COVID, I've developed antibodies to COVID. If I'm exposed now to this new strain, which is, say, the UK strain, the mutant, will I be safe? Am I guarded? Do I have antibodies to, enough to not get the virus, or am I open to this mutation?
Well, it's very likely that the immunity that's been produced against the natural virus is likely to be much more broadband, and therefore it should be able to tackle this new form of the virus as well. And I don't see any problem in that. It's also true that a person who has already recovered and has some evidence of immunity still may benefit from a vaccine, because the immunity conferred by a natural infection is very variable depending upon the viral load, and that could be mild to fairly strong immunity response. On the other hand, a vaccine with a standardized dose of administration, and that too in 2 doses with one as a booster, is likely to give stronger and more durable immune response. So to answer your question, firstly, I believe the natural immunity would still be able to protect against this form of the virus. But when the vaccine arrives, the person who has already been infected is still likely to be benefited by a vaccine-boosted immunity.
And sir, if I have antibodies already, they would be able to counter, say, even a mutant like the UK strain?
Well, as of now, there is no evidence that it's not going to happen, especially since if you have already had an infection against the natural virus and the immunity has been built up against it, then it's likely to be a lot more broadband immunity, and it's not specifically directed only against one component of the virus, which has now been distorted or deformed.
You know, Dr. Parekh, because we're talking about mutations now, is coronavirus COVID-19 here to stay? From a pandemic, are we actually moving to an endemic kind of a phase?
It's too early to conjecture on that. But I think what is important and what is implicit to an extent in your question is that we are always 2 steps behind the virus. See, it's one thing, Preeti, to say that we don't think this won't happen. implying a double negative, and the other to have evidence that something has actually happened. On the subject of vaccines, we could paraphrase George Orwell to say that all vaccines are equal, but some are a little more equal. And on the other hand, Dr. Anthony Fauci, one of the leading international experts in immunology, the other day said that any vaccine is better than no vaccine.
Right.
So between these two statements lies the truth. Yes, I am entirely in concurrence that we should grab whichever vaccine is available. We can hope without being sure that it will address the mutation. But even if it doesn't, some of our existing platforms, such as the mRNA platforms, are constructed in such a way that we can tweak them easily and adapt. So it doesn't help to just keep pondering about what may not happen. We do have effective vaccines. One should get them. And whether it becomes endemic or whether it remains a pandemic, a little too early to conjecture. We've not yet seen the second wave in India.
Right.
You may recollect, we've discussed this before, that the influenza pandemic of 100 years ago had 3 waves, and the second wave, which followed a few weeks after the first wave, due to a mutation, mind you, that second wave was far more devastating than the first. So we have to be cautious.
Right. But Dr. Parekh, I'll ask you a quick question before I move on to our other guests, because you talk about, some vaccines are more equal than the others. Yes, there is anxiety. And, we've got to begin with the fact that take whichever vaccine you get first. But there are those who might want to wait, and they might, if you're looking at being pro-choice, if someone wants to wait for a vaccine, out of the ones we have on offer, which one would have the maximum efficacy if we're talking about mutations?
Well, those who want to wait are, of course, entitled to wait. We just hope that everybody is not waiting. As has been indicated, if we have 60 to 70% penetration in the immunization, we are great, because we must not forget that a certain degree of natural immunity has occurred already by virtue of, herd immunity. And some of the antibodies which are there in the body may work, they may not work. If someone wants to wait, they're welcome to wait a while, but they shouldn't wait forever, because the virus, as I mentioned a while ago, is always 2 steps ahead of us. Let us never forget that.
Right. Dr. Reddy, how do you see it going? Because we've seen multiple mutations already. Now we've seen a mutation of a strain which is 70% more contagious. What are we looking in the long run? Are we looking at something that is here to stay? Like we're going to deal with this virus now? It's an endemic, no longer a pandemic.
Well, let's also understand one thing. Mutations can make the virus more virulent, but they can also make the virus less virulent. Usually the rule of thumb is when a virus becomes more infectious, it becomes less virulent over time. There's a trade-off between virulence and infectivity. So we don't have to be scared of every single mutation. What we really require is to protect ourselves against the infection in the first place by all the public health measures. Second, try and believe that the vaccine conferred immunity is likely to be effective against the virus, unless there are such major mutations that we actually require a different form of the vaccine. And as has been stated, it is not difficult to tweak the vaccines if that happens. But will the virus actually mutate to such a form in a couple of years that we may really require one more round of vaccination? We do not know yet. But as of now, since the whole idea is to confront the ongoing pandemic, I believe the vaccines that we have right now and the vaccines which are very much under development and are likely to make the grade soon will serve the purpose.
I'm going to ask all of you one question, which right now everybody is looking at, because there are flights to London which are banned at least till 31st of December. There's indication coming that might even go on further. As doctors, as somebody who've studied this virus, the effect of this virus, Dr. Vikram Talukar, I'll ask you, what can India do right now? Because you have a strain which might not be deadlier, but definitely is 70% more contagious. How do we protect our public health from here on? Because right now, India is at a place where we're, actually recording some of our lowest cases every day.
Yes, so I think that's the key here is public health message, which was again given long back when the first lockdown happened. We know that this strain is more transmissible, Luckily, it's not causing more serious illness or deaths. So the key here is testing, tracing, isolating people who have it. So the first thing to do is people who are bringing the infection in, although you could argue that this may have gone on for 2 or 3 months in September, and we're only screening and testing people now, and the mutation may have already entered long back. But now where the position we are, all we can do is we can test people who come in at all sort of airports, any other entry points into the country, make sure that we pick up these mutations. So I know that India is already expanding the genomic sequencing testing. And as soon as you find out the people who have got this infection, you isolate them, you quarantine the contacts, you try and trace people who have been in contact of these particular individuals. That testing, tracing, isolating is key. And in addition, all other people have to continue all the measures, which is the social distancing, the masks, and the sanitation.
Right.
This is really, really, really the key. And then you've got the race against the vaccine. So remember that while you're doing this is just buying you time so that you don't have pressure on your hospitals. The other side is trying to get up your vaccination. So hopefully the Oxford vaccine will have approval next week or week after. And then the Indian vaccines should be ready pretty much soon thereafter, in a month or two. Then you've got to catch up with your vaccination. So you have 60-70% over the next 1 year. And that should really create the community immunity that you need to get these sort of herd immunity in the community. So it's a race versus testing, tracing, vaccination versus trying to contain the virus spreading.
You know, Dr. Talukar, you made a very important point, and it's something which a lot of questions are being raised on, and I'll bring Dr. Reddy in on this. When we talk about genome sequence testing, Doctor, are we equipped? Is India equipped to carry out these tests? Do we have enough units to do it?
Well, we do have, obviously, the larger laboratories and some of the research laboratories are very well equipped to do. But a countrywide network is easily arrangeable because this facility does exist in the industry as well. Therefore, actually, we should not have too much of a difficulty in doing this kind of a sequencing. I believe we will have the capacity. But coming back to the question of vaccine anxiety based on this mutants, let me pose a counterfactual. Suppose we did not have this ability to develop these vaccines at this speed. Suppose we took 3 to 4 years to develop a vaccine. And if we had a couple of mutations in between, what would we have done? We would have still continued with our public health precautions. So now that the vaccine is at hand and there is a mutation, why are you panicking about a mutation? Let us hope that the vaccine works, but continue with the public health precautions that we know are the main safeguard.
Well, fair enough. Dr. Parakh, how do you nobody's, okay, doctors shouldn't get into making any prophecies or else, but the question what many want to ask, India is actually recording some of its lowest cases day by day. Delhi yesterday recorded one of its lowest cases ever. Now, is that a silver lining? Because everybody is dreading this new strain in contrast to that.
Of course, it is a silver lining. And, I'm not sure if I agree with you. Why shouldn't doctors make prophecies? We have to stick our necks out. We have to make predictions. Over about 40 predictions we made in our book in March, including the current mutant strains, have turned out to be right. So it's part of our occupational hazard, if I might say so, to be proven wrong from time to time. But we should stick out. Now, having said that, I do not have anything that would not be repetitive of what the other two speakers said. I entirely concur with them. But I have a slightly different take on this. You asked about the genomic testing, and I'm glad you asked that question, because it's not a simple RT-PCR test. It's another test to tell you whether the mutant is there or not. But I have a different take. Why do we even need it in the first place? Let us understand one thing. If somebody tests RT-PCR positive, regardless of whether it's the mutant strain or whether it's the old strain or even a third strain, nothing changes in terms of preventive measures. We still have to do what we've been talking about for this past year, and which has already been alluded to by my co-panelists. And that has to continue regardless. So it's not that we're going to isolate somebody much more. If the genome sequence is different relative, we have to escalate our testing. We've been talking about this since March. We're doing well. There's still tremendous scope for escalating our testing. We have to follow this. And of course, the silver lining is always there to encourage us that what we are doing is working, and that we just need to continue doing it.
But Dr. Parekh, now you said you're open to making prophecies. Are we going to see another big spike because this particular strain is 70% more transmissible? Or you know, we've seen the worst of it?
I don't believe we've seen the worst of it. It's, again, not a question of my knowledge. It's just looking back at history and seeing how pandemics have behaved in the past, whether they're viral or even bacterial. So there is, and what has happened in this pandemic? I mean, you've had second waves in Europe. Germany did phenomenally well, only to be hit again. Sweden tried a different method, and everyone thought that might be a good model. They got hit again. And most important, the poster child of how to deal with the pandemic, the South Korean effort, worked brilliantly, and they too got hit with the second wave.
Right.
So, you know, the second wave is something that is likely. Now,
but hasn't India already dealt with the second wave, Dr. Reddy? Or are we still bracing for another big spike?
We have had a bit of mountains and hills and valleys. We have not really had one single large wave which had happened before, and then another large wave coming up again. But I fully agree, we may still have further spikes. We should not completely rule them out, but we must maintain our vigil until we are sure that we have full control. But because this is a large country and the virus can continue to spread, we should continue to maintain the vigil. But as of now, we have had one large wave with multiple undulations, and we have to hope that we won't get a second sizable wave.
Well, all right. Everybody would be hoping that, you know, in the new year that we're done and over with it, but that's not there. But appreciate you all three for joining us. Thank you. I would reckon the biggest takeaways of that is keep up the vigil. Our numbers might be low right now. You have a strain of the virus which is 70% more transmissible. It might not be as deadlier, but it is 70% more transmissible. So go on, keep your mask firmly in place, and when it comes down to vaccines, take the first vaccine which is available to you. Appreciate you all for joining us. Thank you.